I thought you said that we would have the whole day to get all the solutions, but I will try to start off at least with some ideas on how to work, also being an responsible donor. I bring with me also my very best regards to all of you from Isabella Lövin. She was supposed to be here, she wanted to be here, but as I think most of you know, she has been elected the spokesperson of the Green Party, and we've also made changes in government, which has made her the Vice Prime Minister, but also the Minister for Development Cooperation and Climate. So we're just getting ourselves organized, and then I'm sure she will be back also in these important events. And we have heard about the categories and that they are changing. They are no longer developed or developing countries. And Isabella, she used to say that there are no longer internal politics or international politics. When we talk about the internal affairs in Sweden, in the debate that we had among the party leaders yesterday in the TV, I think you could tell that many of the aspects that we need to handle here are actually global politics and international affairs. And we need to understand that in Sweden, but also in Europe much better. We need to understand the facts to get the best solutions to the problems, but also see all the possibilities that come with this understanding on how the world change. Because the world is in many ways, and this was also said now initially, a better place than it was yesterday. Extreme poverty, child mortality, and the spread of HIV and AIDS. All of these have improved significantly in the last 2 decades, in line with the goals set up with the Millennium Development Goals. And this is something we need to see and also to celebrate. But as we see this, we can also see, and this was for sure seen here in the graphics, that in some parts of the world, in some countries and regions, development has either come to stand still or even been backtracked, and that is mainly in the conflict-ridden and the fragile states and regions. And very often we discuss both achievements made and challenges related to development in partner countries and in our development cooperation. And we know, and you know, all of you here, that development is not easy, not even in peaceful or stable societies and countries. But then in development effort in fragile and conflict-ridden states and areas is so much more complex and hard won. In the following remarks, I will focus then on the conflict and fragile states and the way to reach people in those environments and what we can do, as I said, as donors, also in relation to basic health services. With the ambitious and very hopeful agenda for sustainable development, the Agenda 2030, we have committed ourselves to achieve very ambitious goals, and quite a few of them are goals relating to global health. And especially we need to see the importance of the interlinkages between the goals, not only look at those who by the first sight are about health, but look how the agenda come together. We know that peace and security, health and poverty, but also climate and environment are areas that come together and are interlinked. And we know that this means that we will have to reverse the current trend of many fragile states where we know that 1.4 billion people currently reside in order to make progress. Because it is in these areas that people are left behind. And the goal of the agenda is not to leave anyone behind. And we used to say focusing, as was said, on the fragile settings in the Swedish Development Cooperation, that we need to focus on peace, because without peace there will be no development, but also then on the other hand side, without development we will not have peace, and we need to see how this comes together. Many organizations have already started to planning for the task to see the interlinkages and how to work better together, how to improve our development efforts. And I know that the Global Fund, for instance, with the deputy head, Marike Winrooks, who will speak here today, applies the concept of challenging operating environments. And the fund has developed a strategy on how to work in these environments. This concept and this strategy are about countries, but also about people in regions and within countries. And rather than approaching countries, there is a new focus on people, and we need, as was said, to understand the specific setting where we work, being in a country or in a region. And we need to have a people-centered approach to understand how we will not leave people behind. We focus also quite a lot when we talk about what is the most important within Swedish development cooperation, about the knowledge on how important it is to support on a long-term basis well-functioning institutions. In fragile and conflict-ridden settings, institutions are, and this you know, often lacking or being very dysfunctional. And in the area of health, this is of course a great danger. The institutions will most probably be too weak to handle what are the everyday health services. And we know, for example, and this was also seen, that the majority of maternal mortality is found in humanitarian settings or in fragile contexts. And it's increasing in war-ridden areas. While routine health protection suffers, institutions will be even, of course, then less prepared to handle other severe, sensitive issues, such as sexual and gender-based violence in conflict. And as you also know, this occurs quite often and is an increasing problem in conflict areas. And moreover, of course, different epidemics will spread, and the health systems will not be able to cope with this in the conflict-ridden areas, handling a potential outburst, for instance. And we had the case of Ebola that told us this. As a government, we have then focused on the fragile states, and we need to see how we can improve as donors in these settings. And being the co-chair of the International Dialogue on Peace and State Building is one example on how we want, as Sweden, to see how we can take responsibility, not only as a donor, but also being a responsible donor, coordinating policy-wise, but also in practice with other donors and countries. The importance of prevention, long-term planning, and addressing the root causes of conflicts, and by working together, cannot be stressed enough. It is really important to look at the principles of development effectiveness. Beyond functioning health systems in challenging environments, we need to make relevant development conflicts sensitive based on do-no-harm principles. And the aim is to support and to build and sustain resilient systems for health where people live. And we need to improve the ability to deliver healthcare services also in these fragile settings. And this service should, of course, then also include immunization as well as sexual and reproductive health, which is a top priority for Sweden. So how do we then do to be more responsible as donors and developing partners? Well, partnering with other development cooperation actors and avoiding thinking in silos is key to this area and to many of the areas where we work in development cooperation. Especially in conflict-ridden and fragile states, the risk of duplication and ineffectiveness is particularly high. The UN organization often plays a crucial role in these settings, and it underlines the necessity for them to work well together. And as I see it, it's important that the UN, in the quest of achieving the global goals, need to get its act together and to work much closer to deliver as one within the UN family, but then also, and this is very important, with other developing partners. And in this context, I find it very encouraging to see that within the health sector, there are so many organizations, the Global Fund being one of them, that actually take the responsibility and work together in between different actors. I think it's very encouraging to see this, and I hope that this will be a good example for many other areas of work. The Swedish government sees the responsibility of the UN system, and we see the need for the UN to further develop the ways of cooperating over the borders with regard to humanitarian action, development, and peace building, bringing the agenda together and bringing the different activities together. But to manage this and many other related tasks ahead, the UN needs to have a different way of funding, a more flexible, a more long-term funding. And they need core support. And this goes, of course, to all development partners, be it civil society organizations on the ground or the UN system. And as you know, Sweden has been striving and fighting for the importance of core funding during many years. And unfortunately, we see a much more scattered picture of back donors not taking their full responsibility to give the development actors the possibility to plan on a long-term and predictable basis. We also think that innovative forms of financing should be considered because we need to leverage ODA. The financing for development, which comes together with the new Sustainable Development Goals, shows that we need to look at different innovative ways to really provide more funds for the ambitious goals. And we strongly believe that the organizations working in the area of health, such as the Global Fund, should help us in this and really convince the other back donors not to go into the track of a more scattered financing. We think it's a slippery slope, and we think that we need to convince all those who have been part of the development project for many decades to stay truthful with core funding as being really the most efficient way of working. Now, we talked quite a lot about government responsibilities, the UN family, the big organizations, but then, of course, without doubt, on the ground, we also need to see the importance of civil society and civil society organizations, being, of course, very important and equally important as the development partners in the implementation on the ground in fragile situations. Because in some areas, of course, they may be the only service providers there when we don't have the functioning health systems. And they are then, of course, very crucial for those who would otherwise be left behind. And as a government, we're very pleased that we have also a lot of engaged civil society organizations being partners in the area of health. I guess some of you being here as well. We need to work well together, based on science, coordinating much better as donors, as governments, within the UN family, with a broader range of professional organizations and also with civil society organizations, to be able to develop really efficient strategies to be able to see that we don't leave countries or people behind, as was promised with new Sustainable Development Goals. And getting back to that there is not such a big difference, perhaps, even though at the same time there is. But if you would ask people here in Sweden what is the most important to them, then of course health for themselves and for their families would be the answer. And this goes also then, of course, for anyone who you would ask in South Sudan or in the Democratic Republic of Congo. So this is really core business when we work with the new Sustainable Development Goals, and we need to see how we can ensure that we who are really ambitious in working with our development cooperation can see to that we also have a very efficient and well-functioning work in the most fragile settings. Thank you very much.
Thank you very much, Ulrika. You have now been at the Minister for 2 years. What have been giving you the most hope, and what do you find most difficult in your daytime job?
Well, I think what is very hopeful is that the understanding of the global challenges, but also the opportunities that comes with the progress that we have made is much more known among actors as us being here, but also among the general public. And I think that this gives us a good possibility to move forward. And the idea that we have is that Sweden really wants to be one of the really main players and having really good and efficient development cooperation.
what kind of effect have the refugee crisis during the autumn had when it comes to the awareness and perhaps the saliency of the issues? And how do you see the linkage between fragile states and the risk that you're looking at when it comes to a lot of the refugee camps and the refugee crisis?
Well, I think that the refugee crisis was an awakening, but I think that there's a lot more understanding to be made with regard to this. I think that we will have a long period ahead of us with an increasing number of conflicts, of course, driving people from their homes, but then at the same time, a lot of people looking for new opportunities and migration. And I think it will take quite some time before Sweden and Europe understands the long-term challenges and possibility that comes with this. But the discussion has started, the understanding has perhaps started a bit, but we need much more time, I think, to understand the depth of both challenges and possibility that comes with this.
And we will try to create some more understanding and take a look at more at the opportunities together with a very high-level panel. So I invite you to take a seat